The United States is restricting travel from India beginning next week. The Biden administration issued the new guidance Friday. It comes the same day India received $100 million in COVID supplies from the U.S. The hard-hit nation is battling surging coronavirus infections, including multiple variants. But there is some positive pandemic-related news. More than 100 million adults in the U.S. have now been fully vaccinated against the virus. Janet Shamlian has the latest.
Tonight, more horrifying scenes from India, which has set another global record for new COVID cases in a single day. The healthcare system at a breaking point. Officials announcing today they're closing vaccination centers in India's largest city as the U.S. sends emergency aid.
We have a responsibility as the United States, in particular as it relates to the people that we have partnered with over the years, to step up when people are in a time of need.
It's a far different situation in the U.S., where cases and deaths are declining, but so are vaccinations in places like Arkansas.
The vaccine is more readily available, and it's just not seen as maybe such an urgent issue as it was a couple months ago.
Arkansas is one of more than 10 states not ordering all available vaccine doses for next week. But only 36% of residents have received at least one dose, well below the national total.
We have a good amount of vaccine already in the state, and we felt it was better stewardship to use that vaccine first before ordering additional vaccine.
Some pharmacies make home vaccination visits, but it's often not enough.
We are going into individual homes, people who are shut in and not able to get out and get the vaccine.
Little Rock residents like Zelda Ray.
If they did not come to you, would you be able to get a vaccine?
No, it's hard for me to get to walk because I had a stroke.
Minutes later.
That's it.
It didn't hurt. No big deal about it. And I wish everybody do it.
Some say they're anxious about getting vaccinated. A CDC study out today says it was anxiety, not the vaccine, that caused short-term reactions to the Johnson & Johnson shot that were reported earlier this month. As summer approaches, so does normal life.
If we can continue at this pace, case rates are coming down, vaccinations going up, then I think July 1 would be a reasonable target.
Tomorrow, as many as 50,000 fans will be allowed into Churchill Downs to watch the Kentucky Derby. And Disneyland opened its gates today for the first time in more than a year.
Disneyland is everything to us. Everything is all better when you're here.
The path to all better, health experts say, starts with a needle and an arm.
When you hear that vaccinations are slowing down, what do you think?
I wish people would get the vaccine so we can go back to life as it was and hopefully have some type of normalcy.
The Biden administration has now launched a website, vaccines.gov, where people can go to find a site near them, like this one here in Little Rock. They can also text their zip code to get vax, that's VAX, trying to make it as easy as possible for people to get those shots. Elaine?
Janet Shamlian, thank you. For more, let's bring in Dr. Payal Patel. She's an infectious diseases physician at the University of Michigan's Medical School. Dr. Patel, welcome. Thanks very much for being with us. As we mentioned, the U.S. is restricting travel from India starting Tuesday due to the surge in cases there. How serious of a threat is India to the global fight in this pandemic, and do you support that move?
Yeah, I mean, I think it's a Band-Aid on a fire hydrant. We continue to have new cases here in America. India is really struggling with so many new cases. It would just be a bad decision right now to kind of go between the two countries anyways. But really what needs to be happening in each country that's really battling COVID is focusing on trying to decrease the burden of new infections every day using public health measures and increasing the number of people that can get vaccinated. If we can do that in every country, we're facing this all together as a globe.
Well, more than 100 million people are fully vaccinated in the U.S. That's a little more than 30% of the entire population. Remind us, where do we need to be to reach herd immunity?
It's a moving number, but I will say the higher that we go, it's going to be a lot easier to get back to what we were used to, right? So that means enjoying your summer vacation, going shopping, getting your hair cut. And so I would look at your own family and friends. If there's someone in your 100% of people that you know that's still not sure if they want to get the vaccine, ask them. Have them talk to their doctor. Have them ask the questions that are stopping them from getting the vaccine. We're always happy to try to explain as we know more about the vaccines, because the more people that we can really get vaccinated, we're hoping we can get to herd immunity so that we can start getting back to the things that we love.
Well, Doctor, close to 10,000 breakthrough infections have been reported to the CDC, meaning people who have been infected with COVID after being vaccinated. Is that cause for concern?
You know, it really isn't. And this is another reason that getting more people vaccinated would really bring those numbers down. If we can get more people vaccinated, we know that these vaccines are very, very effective. It's something like going out, I've heard this simile, going out into a fire wearing a fire suit, right? You don't want to try it. You'd rather wear the fire suit in the safety of your own home and not have to go into a wildfire. It's the same with getting vaccinated. You don't want to be heading out into a group of people that may or may not be vaccinated, may or may not be wearing a mask. But knowing that most people have become vaccinated, we're going to be able to do some of those things we thought of before. I really think that actually the numbers show that the vaccines are working very, very well in the hospital. The people that we're really seeing that are admitted are often really just the ones who haven't been able to get a vaccine yet and end up getting COVID-19.
It's such important context for people when they hear some of these headlines to understand what a frontline worker like yourself, a healthcare worker, is actually seeing in the hospitals. Well, the CDC says that July 1st is a reasonable target for reopening the U.S. Do you agree, Doctor?
We've been doing it a little bit, step by step and thinking about how we continue to move into this year. What's really great is thinking right now in every state, everyone above the age of 16 can get vaccinated. And we're moving that down slowly. There's more and more research coming out that soon 12 to 15-year-olds will be able to get vaccinated. So we're taking step by step, getting everyone vaccinated. At the same time, as more people get vaccinated, we're going to be able to get back to work, back to conferences, maybe back to travel, some of the things that we really enjoy doing during our summers. It really is up to the American public. That's what I would say. If you really want to get back to those things, it's up to you and your friends and your family to get vaccinated so that we can have some of our summer back.
And is the coronavirus something that you think is going to be around for a while? And should we be concerned about potential outbreaks or pandemics in the years to come?
That's a great question. I just had a conversation today with a patient about this. If one of the reasons that you haven't gotten vaccinated or you're not sure if you're going to get vaccinated is you think you might have had COVID earlier, remember that a vaccine is really the key to having a longer immunity. So again, if you've either had the infection or aren't sure if you did, talk to your doctor about getting vaccinated. We aren't sure yet what we're going to see kind of coming forward in years forward, but it looks like right now the COVID-19 does not seem to recur as easily, and it doesn't seem to mutate as easily as the flu, which is actually good news. Now, from an infectious disease perspective, I am unfortunately 100% sure that in my lifetime, we are going to see another pandemic. So this is why it's really important to continue to listen to science, try to follow those public health measures so that we can continue to live our normal lives.
Wow. Listening to you speak, Doctor, as someone who's devoted her life to this, dealing with infectious diseases, is really sobering, but important that people understand what could be around the corner. Dr. Payal Patel for us. Doctor, thank you very much.
Thank you so much.